really need Queenslanders to listen to, and together we can get through this, because our number one goal is to keep Queenslanders safe. So overnight we have had 9 positive cases of COVID, but they are in hotel quarantine, and more than 13,000 tests. And I really want to thank people who've come out in their thousands to get tested, but we still want more people to get tested. We want to see higher testing rates, especially in those areas we outlined yesterday. Today we are going to be making a very significant announcement, and we are doing this to keep Queenslanders safe. We know that this UK strain is highly infectious. It is 70% more infectious, and we are going to go hard and we are going to go early to do everything we can to stop the spread of this virus. It is incredibly contagious. I have been briefed extensively by Dr. Young. I have accepted Dr. Young's strong recommendations, and we'll be taking the following actions. Greater Brisbane will be entering a 3-day lockdown. That will be Metro North, Metro South, West Moreton. So let me go through the council areas to make it very clear for everybody. The areas that will be declared Greater Brisbane will be the council areas of Brisbane, Logan, Ipswich, Moreton and Redlands. From 6 p.m. tonight, Friday, to 6 p.m. Monday, all residents living in those areas will be required to stay at home. Think of it as a long weekend at home. We need to do this. I've accepted the strong advice from Dr. Young. If we do not do this now, it could end up being a 30-day lockdown. So we will do a very strong 3-day lockdown in those areas. You will be allowed to go outside for those 4 essential reasons that we did back in March. So they are to go to essential work. If you can work from home, please do that, but it is coming into a weekend, so that is good news. You can leave home if you are providing healthcare or support for a vulnerable person, or you can leave home for essential shopping, but within your local area. And the 4th reason is to exercise in your local neighbourhood. I know this is going to be tough on businesses over the next few days, but I'm thinking about your long-term futures as well. So it is incredibly important that we take these strong measures. Now, the other thing we'll be doing, which we haven't had to do before, and once again I'm taking the strong recommendations of Dr. Young, and we will be mandating masks in those areas if you are leaving home. So if you are leaving home, you are leaving your place of residence from 6 p.m. Friday to 6 p.m. Monday, and you are living in those council areas again, let me say them again, Brisbane, Logan, Ipswich, Moreton and Redlands, you must wear a mask. There are plenty of masks out there. If you are a child, under 12, you do not have to wear a mask. So Dr. Young, will go into a bit more detail about that. So we are doing this to make sure that we keep Queenslanders safe. These are tough, strong measures. Like I said, this is incredibly infectious. We are going into National Cabinet. I've just advised all of my colleagues that we are declaring that Greater Brisbane area a hotspot, and I'm also asking my colleagues from other jurisdictions to also declare Greater Brisbane a hotspot until we get through this together. I'll hand over to Dr. Young, but if you are in Brisbane, in those Greater Brisbane areas, and you may have planned a vacation over this weekend, I'm so sorry, but you will not be able to go. You will have to reschedule until Tuesday. So please, everybody, let's be in this together. Let's stay at home. Look at it as a long weekend at home with your family and friends. You are allowed 2 visitors to your home. Once again, we did that back in March and April, if that is required, other than your household members, but that would be for specific purposes such as supporting someone. So look, I'll hand over to Dr. Young. We are advising all the hospitality industry at the moment. We are advising businesses. It is going to be tough on everyone for these 3 days, but I think everybody in Queensland, especially in that Greater Brisbane area, knows that what we are seeing in the UK at the moment and other places around the world is high rates of infection from this particular strain, and we do not want to see that happening here in our great state, and that is why we are taking those strong actions today. So I'll hand over to Dr. Young and then to the Health Minister. The Police Commissioner and the State Disaster Coordinator have also been involved extensively in the planning around this. I know people are going to have a lot of questions. We prepared some Q&As to actually put up as well, so people can look to the website as well. There has been a lot of work that has been done around the clock to make sure that this is ready for today. And we'll also put that map up as well for people. I understand a lot of people are also on holidays at the moment too. So if you are on holidays, we need people to be listening to the media, listening to your radio, and also to listen or look through your social media as well. So please get this message out, tell your friends, tell your neighbours. It's incredibly important during this time, if we are going to stop the spread of this infectious strain, this UK strain, we must act immediately, we must act strongly, and we have taken those strong measures today. I'll hand over to Dr. Young.
Thank you very much, Premier. Well, I am confident that Queenslanders can respond to this threat as we've been responding since January last year. So we have been facing this pandemic since January, 12 months, and we have managed it extremely effectively every single time because Queenslanders have listened. And I need people in Greater Brisbane to listen today. So those are the people in Moreton Bay Regional Council, Brisbane City, Redland City, Logan City, and Ipswich City. It is critical because I believe if we can get on top of this today, we will be able to manage it and we will not need to go back through that lockdown period that we had to go through in March and April. We can do this quickly and rapidly. So yesterday we learnt at 4 p.m. yesterday that cleaner who'd worked at the Grand Chancellor had the new variant of COVID-19 that's been circulating in the UK. We know that that strain is 70% more infectious, and we know the extreme difficulty that the UK has had in controlling their outbreak due to that strain. So we need to act really, really fast. We need to find every single case now. We need to find every person who might have had contact with that lady now, find them and get them into quarantine. And that's what we've got to do over the next 3 days, and I have absolute confidence that we'll do that. Until we've found all those people, we can't relax, and it's important we do it immediately. And we know, because people have been very mobile recently, it's actually hard to find people. So I need people to be at home so we can contact trace them, so we can get them to go into quarantine in their home for 14 days, so we can test them and quarantine them and test them again. That's absolutely critical. Then we know this particular variant can spread very rapidly if it gets hold. So my hope is that it hasn't got hold. This woman has been exceptionally helpful with us, telling us exactly where she's been, so we're following up. So yesterday I gave you those sites of concern. I'm going to go through them again because they're so important. Anyone who's been to any of those sites needs to immediately come forward and get tested. So if they've been at the Altandi station on the 2nd of January, Roma Street Station, the 2nd of January, Central Station, 2nd of January, they're important. So we are contacting people that we're able to find. But if you know you've been there, come forward, particularly if you've got any symptoms at all. Then Coles, Sunnybank Hills on the 5th of January, and Woolworths, Callumvale North on the 3rd of January, and the Nextra, Sunnybank Hills newsagent on the 5th of January. So all of those venues were put out yesterday on our website. They're really important. The good thing is that this lady hasn't been to any restaurants or cafes, and when we know they are such a critical area for spread, so that's really good news. And we know people have already started responding. Over 13,000 tests done yesterday, which is exceptional. So we need to continue doing all that testing, and anyone in that Greater Brisbane area, it's critical that you come forward with any symptoms at all and get tested. That is really important at this time. Now, so those restrictions have been put in place for 3 days, so we can find the people who've possibly come into contact with this woman, isolate them, quarantine them, manage them, and where we've not been able to find people, they'll be at home and we'll be able to work out what our risks are over the next 3 days. So that means we did it all in March. Everyone, I think, knows what they're doing and did it very effectively. We're just asking you to do it again, hopefully only for the 3 days. So that's to stay home, except for those 4 reasons. So, of course, if you need to go to work, you're an essential worker, you can't work from home, remembering we're going into a long weekend, and maybe Monday could just be extended and people work from home on Monday. So that's the first thing. Or if you need to access healthcare, of course, leave home to access healthcare. Then secondly, to buy any essentials, food and so forth, there is absolutely no issue. All our shops are fully stocked. There will be nothing stopping that happen. There is no need to go and buy up big. If you've got enough at home for the next 3 days, just stay home and wait till next week to do your shopping. Then, if there are any vulnerable people that you would normally provide care for, of course, go and provide care for those people, remembering, as back in March, they're at higher risk. So if you don't need to, don't go and visit your elderly grandmother. We last night put in place restrictions for our most vulnerable venues, so aged care, disability accommodation services, prisons and hospitals. So all of those closed down last night and visitors aren't allowed. So we've already done that work. If you normally provide care to a vulnerable person, think through what the risks are there. You don't want your elderly relatives to end up getting this strain of this variant of the virus. So then the last one, exercise. It is important to exercise, of course it is, but please do so in your local area and do it in your family group or at most with one other person. Again, stay local and protect your family and yourselves at this time. We don't want this to spread. Then the other restrictions that everyone's very familiar with have also come in. So we're limiting funerals to 20 people, weddings to 10 people. This is just for the next 3 days. We're asking people not to go to any non-essential businesses such as hairdressers, nail salons, etc., cinemas, gyms, all of those sporting activities over the weekend, organised community sport, all of that is just on hold. We just need to take a pause for the next 3 days and just see what this single case means. Now, we have all seen other states and indeed ourselves deal with other cases, and we've allowed things to continue. And that has taken us then weeks to get on top of it. But we got on top of it. I'm really concerned that if we were to have cases from this very, very contagious, infectious virus, that we wouldn't be able to get on top of it. So that's why we have to bring this in fast rather than be able to wait and see what the extent of the spread is, because once it's spread, it would be too late to act. It would be very difficult, as we've seen in the UK. So, as of 6 p.m. today, we're asking people to essentially stay home. Have a weekend with your family in your own home. That's important. If you have to go out though, I'm asking everyone, because we have plenty of supplies and we have checked, I'm asking everyone, if when you walk out your front door, put a mask on. That's another barrier to this virus, and that is important. So please, today, if you don't have masks, I know most people do because we've been messaging for some time now the importance of masks. If you don't have masks, please go and buy a box. They're readily available at many, many different places. That's important, but even better, just stay at home and you won't need a mask. Thank you.
Thank you. We know Queenslanders can respond when we need to. We have been doing this for the last 12 months. We need Queenslanders to step up again and work with us. We know this is going to be tough, particularly on businesses, but better we do this for 3 days and get this under control than spend weeks or months in strict restrictions. We do have to be preventative because we know that the level of infection is very high in this particular variant. We have to act differently to what we had before. Any delay could see significant, if not catastrophic results. Now, this is not hypothetical. We're seeing this playing out in the United Kingdom right now. The United Kingdom has had 2.8 million cases since the start of COVID. 2.8 million cases. 1.1 million of those cases have been in the last month. That means 38% of all of the positive cases in the United Kingdom have occurred only in the last month, and that is because of this new variant. We are now seeing this new UK variant spreading throughout elsewhere in the world, including Europe and the United States, and now here in Australia. If we waited until Monday afternoon in 3 days' time, we don't want to be standing here saying, if only, because if we have multiple cases by that stage, it is highly likely that we would struggle to get it under control. We cannot take that risk. We cannot risk people's lives and the economy, because it would do far greater damage to have long-term restrictions in Queensland than a three-day shutdown of just the Greater Brisbane area. We're also asking people, not just those who are residing or staying in the Greater Brisbane area, in the local government areas that have been announced today, to remain at home for the next 3 days. If you have been to the Greater Brisbane area since the 2nd of January, but you are now elsewhere in the state, we are asking that you also stay where you are for 3 days. You isolate yourself for those 3 days. So if you're a local resident but you've gone off holidaying in Gold Coast or Sunshine Coast or Cairns, please stay where you are for 3 days and do not move around your area. If you are someone who has been travelling through, again, we ask that you take this advice and you remain isolated for the next 3 days. Of course, if you are anywhere in Queensland or you are interstate and you have been in Greater Brisbane area since the 2nd of January and you have any symptoms whatsoever, we ask for you to come out and be tested. We have clinics open across Queensland, particularly in the Greater Brisbane area. We have longer hours established for our public clinics, and also our private providers are opening over the weekend and will have longer hours. And many of those private providers do not need a referral from your GP. So check on the websites of the private providers, or you can check on the Queensland COVID website and you'll be able to find both public and private providers and see whether they require a referral and also what hours they're operating. I also want to acknowledge the Queensland Ambulance Service, who overnight maintained the 8 Mile Plains Clinic for us. We have had that operating over the last 24 hours. And after 10:30 last night, over 200 people got tested. There was a small surge but it was certainly managed very well, and that clinic remains open and will remain open for the next 24 hours as well. And of course, clinics will be open over the weekend and the next 3 days for anyone who needs to be tested. So please, you have any symptoms whatsoever, we do ask that you come out and you get tested. We want to thank businesses for working with us and for the people of Queensland and particularly Greater Brisbane for stepping up and working with us to contain this virus. We want to make sure that it doesn't leave anyone's homes if anyone is positive, and we're able to ensure that there is not broad community transmission. As the Premier and the Chief Health Officer has already said, if you do need to leave home, if it's for work, if it's to go to the shops, if it's to go to look after a vulnerable person, if it's to go to get medicines or to the doctors, wear a mask. Even if you're out exercising, wear a mask. There are masks in our supermarkets, in our chemists, in lots of shops all through Brisbane. You don't need to buy multiple boxes. We're not asking people to race out and hoard the boxes of masks. Just take what you need. One box will be plenty. We're talking 3 days. So please, if you haven't got a mask, get your mask. And Queensland Police will be out and checking people to ensure there is compliance in the community. But we know that Queenslanders will step up and do the right thing. You've been doing that for 12 months. Now is more important than ever, and we need everyone to work with us. So again, those local government areas, Moreton Bay Regional Council, Brisbane City Council, Ipswich City Council, Logan City Council and Redland City Council. Please, from 6 p.m. this evening till 6 p.m. on Monday, stay home unless it's essential reasons to leave your home, and let's all work together and be united to get COVID under control and to keep our community safe.
Thank you. Good morning, everyone. This is an extremely critical time. I would ask that everyone takes the next 3 days very, very seriously. It is important that we all do our bit to comply with the new restrictions, and as has been indicated many times this morning, that we prevent the spread of this new strain. It is, as you've heard, 70% more contagious than what we have seen before. In working together, Queenslanders have done an excellent job in the last 12 months in preventing the spread of COVID, and it is now very important that we remain vigilant and adhere to the new restrictions from the Chief Health Officer. The Queensland Police Service will be putting additional resources to this over the next 3 days, from general duties to our specialist police, including the Public Safety Response Team, Water Police, Mounted Unit, Railway Squad, the general duties from the various districts, our tactical crime squads, our shop fronts, and the list goes on. We will be conducting additional patrols, random intercepts, and making sure that everyone is complying with the directives. As always, we will continue to use communication, compassion, and ultimately, though, if there is blatant disregard of the directives, we will be ensuring compliance. And that may be, and I know Queenslanders have done this extraordinarily well, so please work with us, but they may be even issuing fines, as you know, and even more seriously than that, even being charged. We have done this before, and I know that we can do it again. We have done it exceptionally well, and I ask your cooperation in dealing with this situation over the next 3 days. Thank you.
Morning all. If I could add to the Commissioners and the Premier's, Cho and the Minister's comments, just to give you some details around what you could expect to see. Bearing in mind that we are day 346 since the declaration of the health emergency in Queensland, this highlights to us that we are not done yet and we need to really stay vigilant. So as the Commissioner indicated, you can expect to see high visibility policing, and including today. So people really need to understand that while things kick in from 6 p.m. tonight, we are encouraging people in the lead up to that to make sure they're not out and about unnecessarily. So please listen to the messaging. That is the first point. Please understand what is required of you and whether you are impacted and what you need to do to be able to achieve what we need to achieve. So you will expect to see high visibility policing and messaging in our community around what is required of people. Our police will intercept people that are out and about. You will be checked if you are out and about to see whether you should be out and about doing what you're doing. So make sure before you leave home, as well as having your mask, that you are within the exemptions that the Chief Health Officer has given for people to be able to leave their homes. They are fairly simple, and they are pretty well exactly what we did back in March, so people should understand what is required of them. As the Commissioner indicated, we will always use communication compassion before we achieve our compliance, but if people recklessly or ignorantly or carelessly breach the rules, they can expect enforcement action to be taken against them. And any breach of the Chief Health Officer's directions within this scenario at present carries a $1,300 fine. So people need to understand that. So you should remain in your home and in your local communities for the coming 3 days. You should wear masks, you should practice social distancing. We also need to make sure that we are looking after our personal hygiene. These are all very important things that people need to understand that they have to do. And whilst there will be high visibility policing and a number of resources committed to this, the total resources of government are committed to making sure that everyone understands what is required of them and that we can achieve this over the coming days. So the work is happening right across government, not just in the Queensland Police Service. And I'll just finish off by saying that the community can be rest assured that we have sufficient resources to be able to deal with our normal policing. This is not licensed for people to go out and commit offences because we have a lockdown. In fact, it's going to be much harder to do things. So we want people to do the right thing across the board, and we will still be able to do our normal policing to ensure that our community is kept safe. Thank you.
Premier, one case,
Yes.
I know it's a new case strain,
Yep.
more contagious. People might think this is an overreaction.
No, it's not. This is incredibly serious. We are seeing what's happening around the Northern Hemisphere. We have to take it seriously. In fact, AHPPC met yesterday and they also agreed that if this strain was out in the community, much stronger measures needed to be taken rather than what happened in the Northern Beaches.
Was there any thought of declaring Monday a public holiday?
No, but we are asking employers to be sympathetic to this situation because it is unprecedented and it has to be done.
Families are on holidays in the
Yep.
Gold Sunshine Coast all over the state. So
Yes.
They can't, if they're planning to check out tomorrow morning at 10 o'clock like everybody else.
They can come home. They're allowed to come home. So if you're in the Gold Coast or the Sunshine Coast and your home is in Brisbane, you can come home, but you will stay at home.
I thought the Health Minister said to stay where you are.
No, my understanding is that you can come back to your house and stay in your house. But if you are planning to go on a holiday there, then you must reconsider and you must stay in your home. But if you have travelled elsewhere, if say you're in Brisbane and you're travelling like to Mackay or Cairns today, then you must stay where you are heading to until Monday.
Why is this lockdown area not wider than the one that's being prescribed? Why is it not the Gold Coast and Sunshine Coast?
Yeah, well, this is the advice from the Chief Health Officer. We have taken that advice and we've looked at the movements, and most of her movements have been in that Brisbane area, and also we've looked at her close contacts. There are around 79 close contacts that have been identified to date. So once again, can I just stress this is very serious, and as I said, doing 3 days now could avoid 30 days or longer in the future.
And when is the 79 close contacts being tested yet? When will those results come back?
Well, they'll do that as soon as they possibly can, Jack. Yeah.
Why are these quarantine hotels? Why are they in the CBD, not in a regional area or somewhere like that?
Well, they're in the CBD in every major state, Sydney, Melbourne, Adelaide. It's close to the hospitals. That's where the quarantine. But what we are seeing now is more people. Look, today is our highest. 9 people have tested positive coming back from overseas, and we've got a National Cabinet meeting this morning, and we'll also be discussing that.
Is there a worry that locking the city down would cause testing rates to drop?
I don't think so. I think people will still go and get tested if they have any symptoms. In fact, we'd like to see more testing rates. We'd like to see more people tested if they have any symptoms, to please go and get tested. And if we get through the next 3 days and we don't have any cases, well then fingers crossed, we're out of the woods.
And when will we know before Monday?
We'll be updating you every day, so we'll keep the community updated. But for example, so today, if you were scheduled to go and visit some friends in another part of the state, I would urge you to reconsider that and to stay at home.
I can leave my suburb, my locality,
Yes.
to go and get tested in another suburb.
Yes, as long as it's close by to your nearest clinic. Yep. So that's on the website. But we also want people to stay in their neighbourhoods for the next 3 days, and ideally stay at home as much as possible.
What is that radius that you can travel again?
We're asking people to stay in their neighbourhood. I think that's the clearest message we can say to people. So you can still get your local takeaway, just what we did back in March.
This strain is more contagious. Are people any sicker from it?
They don't get any sicker. I might get Dr. Young to talk a little bit more, but this is a new strain. It is 70% more contagious, and it means that I think you carry more of the virus load, which means it can be spread faster. That's why we need to take this immediate action. But I might get Dr. Young to address that.
So as people returning from the UK, they've been now separated from everyone else. Is that how it's going to work out?
The hotel where the cleaner worked is currently in lockdown. That hotel is as well, so we've taken that strict measure. But look, I might just get Dr. Young to address how contagious why we're taking this action, and maybe if you could address, Dr. Young, to AHPPC's advice from yesterday as well.
So this virus, this variant of the COVID-19 virus, is 70% more contagious. So that means it'll spread much more rapidly and to many more people. And we've already seen that one case in hotel quarantine has spread to a cleaner and also spread to his partner. So it is a very contagious variant. Now, at the moment, but this is early, remember, we're sort of almost back where we were in March, knowing very little about the virus. So this is very early days. At this stage, the evidence coming out of the UK is that it doesn't cause more severe disease, it doesn't increase mortality, and most importantly of all for us, it doesn't affect the efficacy of the vaccines that have been developed to date. That's very important. The issue is that more people will get it, and we've seen that in the UK. So today in the UK, 1 in 50 of their population is sick with COVID-19. So it is causing problems for their health system. Their health system can't manage the numbers. So if you can't manage the numbers, although this doesn't cause any more severe disease, if you can't provide oxygen and the basic care that those people then need, then the consequences will be worse. So fewer people have it, we can provide fantastic care, and we've seen that in Queensland. We've seen that the people who've needed intensive care in Queensland have survived, whereas in other countries they haven't necessarily, because there's just too many people to give care to. So the idea here is that we want to minimise the number of people who get infected. The vaccine, although there was really good news yesterday from the Prime Minister that we're going to be rolling it out earlier, so we'll start rolling it out in February rather than in March, which is excellent. That's still more than a month away. So mid-February is when that is. So we have to get this under control now. You can see in the UK, they've already started rolling out their vaccine. Despite that, they're seeing increasing numbers of deaths. So we really must manage this. So the next 3 days will give us a chance to work out how much spread there's been. It'll be too late if on Monday I stand up here in front of you and say we've had 10 cases and they've been out infectious in the community, infecting people. We can't put it back in the box. We've got to act before we get the cases. And hopefully we know that not everyone spreads the virus, even with a more contagious variant. Hopefully it won't spread. But it's too late if it's spread to then try and undo that spread. So that's why we've got to act today, and we have to act really fast. And I just ask that People in Brisbane went through this, Greater Brisbane and those 5 LGAs went through this back in March. I ask you to do it again for 3 days. You did it much longer then. Just for 3 days, have some time at home, recover after the Christmas, New Year period, and just spend the weekend at home with your family. That's a really important thing we can all do while we get on top of this. Now, I'll just address why we haven't included the Sunshine Coast and the Gold Coast, because at this stage we do feel, given to the enormous cooperation from the cleaner, that she has not been outside of this area. So yes, there will have been people who've visited Brisbane from the Gold Coast and the Sunshine Coast since the 2nd, and I'm asking that those people stay in their homes for the 3 days as well, rather than asking the entirety of that area. If things were to spread, then of course we'd have to look at a broader lockdown, as we did back in March. But I'm hopeful that this is contained within Brisbane.
Could not some of those 79 close contacts have been to the Gold or the Sunshine Coast?
No, that's why we've got hold of all of those people, and we don't believe at this stage we have tested symptomatic ones and they don't have the virus. So I'm as comfortable as I can be that it is the right thing to focus on those 5 LGAs.
Premier, just briefly, is there any update on the Gabba?
Still talking, yep, so still positive talks at this stage. Yep.
Do we know how many people from the UK are coming to Queensland every week at the moment?
I don't have those details. The federal government would have those details.
Has there been any development as to how that this woman contracted the virus? Any indication as to how that might have happened?
Well, it's incredibly contagious, and there'll be an investigation into that as well, Jack. We'll just have a couple more questions on National Cabinet. Yeah.
Will there be a change to hotel quarantine, for example, now, daily testing for everyone involved?
I think Dr Young addressed that yesterday and said that it was on the shifts that people will get the testing.
Are there any restrictions on how many people you can have at home over those 3 days?
You can have 2 additional people that can come to your home, but they have to come for like a good reason. Right. Yeah.
If someone's going to say Mount Isa on holidays for a couple of weeks, should they come home or should they stay where they are?
I might leave that one to Dr Young, but
They should just stay. If they've left, they should spend the next 3 days in isolation in Mount Isa if they were in Brisbane from the 2nd. But if they're already there, they should just stay there, stay in isolation for 3 days and then continue their holiday.
Just to clarify something you said before, the case in hotel quarantine with the UK Australian has passed it to his partner. How many cases for the UK Australian in Queensland at the moment?
We've now got 5. I'd have to check, but I think we're up to 5 and 1 South Africa.
Are they all at the Grand Chancellor?
No, they're in hospital. As soon as someone tests positive, they're in hospital.
But did they come from, were they in origin at the Grand Chancellor?
Yeah, not just the Grand Chancellor.
I think the Deputy Commissioner said before the fine is $1,300 for breaking. Is that for all the directives? I just want to include the mask mandate.
the mask, my understanding is $200.
$200 for the mask.
Yeah. Yeah. All right. Okay. Thanks, everyone. Thank you.
John.